I'm Jai, and this is the start of my video series from Pediatrician to Primary Physician. First off, what is From Pediatrician to Primary Physician? From Pediatrician to Primary Physician is a project that aims to educate teenagers ages 16 and 17 on how to transition from pediatric care to adult care. In other words, how to find a new doctor for when we become adults. Why am I doing this? In society today, there is a disconnect between young adults advocating for themselves and adult physicians' knowledge of how to communicate with young adults. This disconnect, caused by a lack of information from pediatricians to teenagers on how to find a new doctor and a lack of knowledge from primary care doctors on how to interact with young adults, can cause young adults to simply funnel to their parents' doctor, which may not be the best fit for them. For most teenagers, the thought of leaving their pediatrician and finding a new doctor can be difficult because they feel as if they're breaking a strong bond. It is difficult to find the same level of care, or even as simple as not even knowing where to begin with finding a new doctor. That last reason is the point of these videos. I want to make teenagers and young adults more comfortable with finding a doctor when they so choose. As a disclaimer, if you feel you are not ready to start looking for an adult care doctor, then most pediatricians continue care until around the age of 21. For this video, I will be going into the first step of finding a primary physician. To begin this process, you should first know your info. Knowing your information is important because it will help guide you in the decision-making process to find a doctor. Information to learn includes your medical history, your family's medical history, and your insurance information. First information to learn is your medical history. This includes any medical conditions or major surgeries you have had. In order to find out this information, ask your parent or guardian who has handled your health care in the past. The next to learn is what insurance you have. Most importantly, do you have your own insurance or are you on your parents'? If you are on your parents' insurance, what age are you kicked off and need to find your own? Lastly, learn your family medical history, including any genetic conditions in your family or major health events in your immediate family. Step 2 of this process is getting a referral for a new doctor. If you're wondering who to ask, your pediatrician is a great person to ask. In your next appointment, ask your pediatrician if they can refer you to any doctors they know and trust to give you a similar level of care. Other people to ask include friends who have recently found a doctor, friends with an adult care doctor, and family. Step 3 of this process is creating a checklist. Finding a doctor is for you, so it's important to know what you're looking for. To do this, you need to develop a checklist of your wants and needs in a doctor. Things to include in this checklist include the preferred gender of your doctor. Some people feel more comfortable with a doctor of their own gender or vice versa. Preferred location of the office is important because there is no use looking at a doctor who is beyond where you are willing to commute to. Third, what does my insurance support? Some insurance companies have a page on their website of healthcare providers they support. Going to the doctor under your insurance ensures your out-of-pocket fees are limited. Next, if you have a medical condition, it may be important to you to find a doctor who has experience in patients with similar conditions. Lastly, what type of doctor do you want? You can consider internal medicine, specialist, or family doctor, or general practitioner. A family doctor or general practitioner is trained and experienced in patients of all ages that do not specialize in a specific area of medicine. These doctors can provide a general level of care. An internal medicine doctor treats adult patients on a wide variety of illnesses and concerns. A specialist is a doctor that treats patients with specific illnesses or concerns. For example, women may look into a gynecologist for treatment or concerns about their reproductive organs. Some insurance companies require you to go to a general practitioner to receive a referral before going to see a specialist, so check your insurance. After developing this checklist, you should research doctors who fit these needs. To find doctors, you can look at websites such as healthcare.org, Google doctors in your area, or even use Yelp for doctor reviews. Step 4 is narrowing down the list. After researching doctors who fit the preferences specified in your checklist, narrow down the list to at most 5 doctors you are interested in. With these 5 doctors, you should research further to learn more about each of them. Questions to further research about these doctors are, is this doctor taking new patients? If a doctor is not open for new patients, then check if they have a wait list. Which hospital do they use? Check the location of the doctor's office to determine how far away it is and if you are willing to commute to it. Do they have training in my medical conditions? And again, make sure your doctor has experience in treating your condition so you receive proper care. Are they a part of a group practice? A group practice includes multiple doctors who work together to care for patients. If you prefer to have one doctor, then a group practice may not be for you. If you are okay with the possibility of having multiple doctors, then look into a group practice. If you decide to look into group practice, research if you can book with a specific doctor or if you will receive anyone available in the office. Also, look up how old the doctor is. This can be a deal breaker for some people. Choose a doctor whose age you feel comfortable seeing at the appointment. Well, that's it for this video. In the next video, we will be going over booking the appointment and actually going to your appointment to decide if you would like to continue going to that doctor. I'll see you next time. This is from Pediatrician to Primary Physician, signing off.